Hello. Well, Sue Lynn's been nice enough to let us use her as a film subject today. And what we're going to do is we're going to be using a little bit of really the workhorse of our practice with regards to synthetic filler. We use Restylane, and we use it fairly interchangeably with some of the other hyaluronic acid products. And Sue Lynn's area of concern is a very common one. It primarily involves the deepening of what we call the nasolabial line. And it's this triangular depression that extends out from the base of the nose down towards the angle of the mouth, and they can be, of course, variable length depending upon the individual, and there's certain specific gender anatomical features between men and women with regards to how long and how deep those lines are. And of course we have a variety of different things in the arsenal that we can use. In our practice, the real workhorse though is Restylane. Depending upon the depth of the nasolabial line, we oftentimes will layer the product using a heavier cross-linked product in the deeper aspect of the tissue, and then subsequently layering with our Restylane products on the surface. And we even have some products that are even more lightly cross-linked that can be used for very, very superficial injection. The areas that Sue Lynn has that we're going to address today, though, are, if I can take the liberty of marking, we're going to address these areas, which are really a function of the dropping or the gravitational descent of the midface. You can see that pulling the midface up and into a slightly better location always tends to soften up the depth of these nasolabial lines. Restylane and a host of other synthetic products really allows people to buy a lot of time with regards to having to do any type of suspensory or anti-gravity procedures by allowing us to fill the depth of those areas and help build that tissue back up to a better location. So what we're going to do is numb up Sue Lynn and get her ready, and then go ahead and show you how we inject the product. So Sue Lynn's been nice enough to let us numb her up, and she's all numbed up in the respective area. We outline the borders of the area that we'd like to confine the product to. Everybody's a little bit different with regards to the injection technique. You can use kind of a linear threading technique. You can use a multi-puncture technique. I tend to use a little bit more of the multi-puncture technique and then some subsequent smoothing before the patient leaves the office. I think that it provides a more uniform level of product distribution. So we'll go ahead and we'll get Sue Lynn injected here. Kind of create a series of elevations just underneath the surface of the skin in that deeper aspect of the dermis. And we'll do the same thing on the opposite side. I know it's difficult to see from the camera angle, but we get a most definite elevation in the actual contours of the tissue. And then what we'll do is we'll go ahead and we'll, from an external approach, we'll basically massage the tissue so that we get a nice uniform distribution of the Restylane in the tissue area to provide that level of correction. What our end point is my ability to feel, and if you can open your mouth, Sue Lynn, for me, and close. What we're trying to feel for is a nice uniform distribution of the product. And then visually, I'd like to see what I would consider to be a satisfactory endpoint for, and then open Sue Lynn again, a satisfactory level of contour improvement. We know that the product is capable of, because it's quite hydrophilic, it's going to pull water into the tissue over the course of the next couple of weeks and provide her with an increased level of improvement well beyond what we actually see when Sue Lynn leaves the office today. And then we'll provide Sue Lynn with an ice pack and ask her to do her due diligence in keeping the area well cooled and iced tonight, which just helps to limit the bruising and the swelling and get people back to normal levels of activity in a timely fashion. Okay, well, thank you very much, Sue Lynn.